It's impossible to overstate the impact that depression has on humanity. The World Health Organization ranks depression as the #1 cause of disability in both men and women across countries, across cultures. Nothing would have a greater, more positive impact on humanity than conquering depression.
I study depression through the lens of neurology. And the way I've done that is to basically use imaging as a way to really look at what's wrong in the brain when people are depressed.
Not every patient has the same fundamental type of depression, meaning the same problems with their molecules or cells is not in everybody. Using, for example, more advanced imaging techniques at Mount Sinai, like ultra-high field MRI, we're trying to dig deeper and understand at a more basic level the exact causes of where is the dysfunction in the brain in a given depressed individual.
And as you start to map these circuits and you look at how they communicate with each other, you start to see this emerging pattern of how the system breaks.
One of the challenges that we face in studying the biology of depression is that it's very different across different people with the illness. The challenge we have is to understand those differences so that we can design personalized treatments.
My lab has identified inflammation, which is a response of the immune system, as a causal factor in the development of mood disorders. It's kind of a new world of scientific discovery. We're thinking beyond the brain. For the past 20 to 30 years, all psychiatric drug development is focused on pathological mechanisms in the brain. And now we're finding that all of these factors in the body could possibly be causing the disease.
The opportunity now is to invest in support in filling the gap between translating those basic discoveries from the lab into new treatments for patients.
The development of ketamine as a brand new mechanism treatment of depression has led some people who've been desperately depressed for years to be cured.
Mount Sinai has been the site for a recent clinical study suggesting that administration of anti-inflammatory compounds can have antidepressant efficacy.
We've gotten better and better. And as we've gotten better and better, that effect in the operating room is quite dramatic. We could go into a very specific area in the brain and alter the circuit and basically correct depression and keep people well who had never responded to anything.
There's no doubt that Mount Sinai has made major investments in research, and I'm confident that in the very near future we're going to have new breakthrough treatments for patients.
We now have the tools and knowledge in neuroscience to conquer depression, and with the right philanthropy, we could get the job done.